Biowaivers are granted for the immediate release oral formulations containing the BCS class 1 or BCS class 3 drugs. I have made a video on Biowaiver for the BCS class 1 drugs, and this video is for the BCS class 3 drugs Biowaiver requirements. BCS classification system categorizes the APIs, drug substances based on to the solubility and the permeability. BCS class 1 drugs are highly soluble and highly permeable. BCS class 2 drugs are low soluble and highly permeable. BCS class 3 drugs are high soluble and low permeable, and BCS class 4 drugs are low soluble and low permeable. Biowaiver are granted for BCS class 1 and 3 drugs. BCS class 3 drugs have the high solubility and low permeability. The FDA and other regulatory authorities grant the biowaiver for immediate release formulation containing BCS class 3 drugs if the test product has the qualitative and quantitative similarity with the reference formulation. The qualitative composition similarity is called as Q1 similarity, and the quantitative similarity is called as Q2 similarity. The quantitative similarity cannot be very much similar or exact similar to the reference product or RLD. Some differences will be there. So Q2 similarity is called as quantitatively very similar to the reference formulation. The formulation exhibits more than 85% dissolution within 15 minutes. It is the requirement. So limited regulatory concerns are there regarding the BCS class 3 drugs. Limited regulatory precedents raises concern about formulation similarity and the dissolution behavior. If the drug product contains BCS class 3 drug and showing the very rapid dissolution of more than 85% drug dissolved within 15 minutes, but there is a concern regarding the quantitative similarity, that is Q2 similarity with reference to the RLD or reference formulation. Study methodology for BCS based biowaiver involves the solubility study, formulation composition of test versus RLD. It requires the characterization of RLD, dissolution profiles, similarity between the test and reference. Bioequivalence B outcomes based on the excipient variations. Key findings. So bioequivalence can be achieved if there are some differences in the key excipients because of the similarity in the dissolution. There are some critical excipients like disintegrants, binders, then diluents, lubricants, which cannot get quantified exactly, and that's why the Q1, Q2 cannot be the exactly same. There are various grades of the same excipients also. So the grade, though it is not matching, but still there are high chances that the bioequivalence can be achieved. Critical excipients like cross-carbonyl sodium, cross-povidone, povidone, lactose, magnesium stearate cannot be always Q1, Q2 as per the RLD. Most of the test drugs meet the criteria of very rapid dissolution with the dissolution threshold of more than 85% drug release in the 15 minutes, which is the main criteria for BCS based biowaiver for class 3 drugs. Implications and regulatory challenges for Biowaiver on BCS class 3 drugs. Q1 Q2 similarity. Finding suggests that strict Q1 Q2 matching may not be required. There are some percentage variations allowed by the regulatory authorities. There are guidelines by US FDA, EMA, and ICH which provides you the ranges within which the test formulation can be considered as similar to the RLD. FDA may need to adopt risk-based approach for the raw materials and excipients. Limited regulatory precedence, lack of case studies makes predicting FDA decision difficult. Comparison with the EMA guidelines may provide alternative regulatory pathways. Need for the clearer Biowaiver criteria. Biowaiver for the class 3 drugs lack the established framework. This is the need to have the clear understanding about BCS based 3 biowaivers. More scientific evaluations and modeling approach is required. Biowaiver applications requirements. So regulatory strategy and compliance must meet the regulatory requirements from the agencies like FDA, EMA, and ICH. Q1, Q2 excipient risk assessment should be there. Toxicological risk assessment should be there. And in vitro in silico studies can be conducted or are required sometimes. Dissolution and bioequivalence studies, so supporting dissolution profile assessments, developing in vitro in vivo correlation and IVIVC models. So these are the requirements and important considerations. Then there is a requirement for preparing the ANDA Biowaiver dossiers, responding to the queries raised by the agencies onto the Biowaiver application. Bioequivalence based onto the in vitro dissolution, based onto the solubility and permeability of the API, and based onto the composition similarity can help to the applicants and also can provide the medicine to the public in a shorter period of time. So there should be a future research for focusing onto the BCS based 3 biowaivers, considering the role of excipients beyond Q1 Q2 matching. More flexible but scientifically robust frameworks are required, and expanding regulatory procedure to support BCS class 3 biowaivers. In future, collaboration between the industry and regulatory agencies to refine the biowaiver approaches. Integration of modeling and simulation for excipient impact assessment should be there. Then continued research on the dissolution permeability interaction for the next gen regulatory policies. As the biowaiver for BCS class 3 drugs or drug products containing the BCS class 3 drugs is based onto the Q1 Q2 similarity, very rapid dissolution, and the composition similarity, there should be a established framework. There should be a collaboration to have the clear understanding. I hope this video will help you to understand Biowaiver for BCS class 3 drugs and the formulations which are immediate release containing the highly soluble drug substances belonging to BCS class 3. Thank you.